I am 36 years old. Do I need a facelift? My forehead and cheeks are sagging, and it makes me look very depressed. I have to constantly hold a more uplifted expression on my face to combat the sagging. My eyes look very small because my forehead is almost sagging down onto the brow area. The area around my mouth is extremely droopy in my opinion, and I have a serious frown if I don't smile. Also, when I smile, my eyebrows become very uneven.
Thank you for your question. You're asking at the age of 36 if you should have a facelift, and in your question you describe concerns about the forehead drooping down to the eyebrows, your facial expression being sad, and how your cheeks are sagging, and you've submitted a photo that certainly is very helpful. Well, to give you a little bit of background about myself, I'm a board-certified cosmetic surgeon, certified by the American Board of Cosmetic Surgery, and in practice for over 20 years. I'm also a specialist in oculofacial plastic surgery, and I've been practicing in Manhattan and Long Island for this time. So, facelifting, facial rejuvenation surgery is something I do a lot. And I've mentioned in past questions that my youngest patient I ever did a facelift for was 37 years old. Now, when I look at your photo and I kind of get just a general feel of your appearance, my first question to you would be, is, is, is your appearance at the age of 36 a significant change from when you were 34 or 35? Basically, I try to dissuade patients from who are in your age group to having very invasive procedures like facelift. And a lot of times when we evaluate someone like yourself, the skin just doesn't move. And very often it's a combination of lesser invasive procedures that have some value. But first and foremost, we have to make sure that there hasn't been any physical, medical, or even emotional stresses in your life that could be affecting your appearance, whether it's the way the fat is distributed, whether you've gained weight. Basically, lifestyle factors are things that I always establish before we discuss procedures. There are certainly many options to help you look a little bit better. Looking at your upper eyelids, maybe there's a role for addressing that perception of the brow and the forehead sagging by maybe reducing the upper eyelid skin with a conservative upper eyelid blepharoplasty. There may be even being less invasive, doing something like a Botox brow lift. In other words, using Botox in a way to raise the brows a little bit. When it comes to areas such as the outer corners of the mouth or the mesolabial folds, there are times when we've done filler to help soften that for just people who may not be ready for a lift, or for people to just kind of soften these more maybe term harsh expressions or strong expressions. But there are certainly a lot of different options. But again, there is still something that comes to mind when you talk to someone like yourself who is in their mid-30s. Are the elements of your facial appearance that you are unhappy with genetics? Are they genetics aggravated by or accelerated by other life-related issues, medical and otherwise? And ultimately, you have to come up with a plan that is practical for you. But avoiding surgery is probably your first priority for now. There are certainly a lot of different options out there for people in your age group without going towards the facelift. As I said, 37 was the youngest age I did a facelift for a patient for a facelift, but this patient also had a very thin face, very loose skin. It was a genetic trait and a very limited facelift. It's not the type of lift I would do in a 67-year-old. So I think that it's more important that you meet with qualified, experienced cosmetic surgeons, meet with a doctor who's going to spend a lot of time with you. I mean, I think that's one of the things that I really value tremendously in my practice is that I spend a lot of time with my patients and I want to learn about their lifestyle. There's so much to health, fitness, well-being that has to be factored in when we think of the success of any cosmetic procedure. That's my personal perspective, and certainly it's very important to integrate that. We can't take someone who is dealing with a lot of issues that need outside intervention, whether it's health or physical, emotional stress, and make them look better, make them look a little bit better, but certainly you have to, it's all integrated, it all has to work together. So I'd say meet with a doctor that you feel comfortable with and discuss your options and really learn about them and then prioritize them so that you can intelligently and strategically do things that you won't later regret. So I hope that was helpful. I wish you the best of luck and thank you for your question.